Hi, everybody. Welcome. My name is Leah Gropo, and I have the great pleasure to introduce Catherine, who from talking about mindful eating. Catherine is one of the clinical dietitians working at Stanford Healthcare. She's also a diabetes educator. She received her master's degree in nutrition education at Teachers College at Columbia University and completed a dietetic internship training at UCSF. She works primarily at the Stanford Endocrinology Clinic, but also gets to teach diabetes education classes. And so without further ado, I just wanted to give a great welcome to Catherine. We are going to ask that questions. You can put them in the Q&A anytime. We're going to take questions at the very end of the talk. And so we have Catherine.
Thank you, Leah. I'm excited to talk about this topic. So first, I'll go over the learning points for today. So we'll talk about how our internal cues are disrupted by external cues, so things that we tell ourselves or other things that affect how we eat or how we choose to eat. We'll talk about how to break that cycle and be more in tune with your eating by exploring benefits of mindfulness and mindful eating. We'll take some time to practice some mindfulness techniques during this session today. I'll also encourage you to identify your needs, what you might need at a certain moment when you think that you are hungry, but maybe you're not, and brainstorm ways to satisfy and self-soothe those needs. We will also practice challenging harmful thought patterns around food that might not make you feel so good about yourself, and ultimately find ways to move through viewing food with neutral terms. So I'll start with a prompt. Have you ever experienced any of these thoughts? As I read these statements aloud, I want you to think about if you've ever told yourself this, or maybe you heard about this from someone else or was told this. What emotions come to mind and what do you feel when I read these thoughts aloud? I might as well eat the whole box because it's my cheat day. I'll eat clean for the rest of the week. I ate too many unhealthy carbohydrates earlier, so I'm only gonna have vegetables for dinner. All processed foods are bad. I can never control myself when I am around sweets. I have no willpower. So think about what feelings come up with these statements. Do you have feelings of shame, guilt, thinking that you deserve to be punished? Do you feel distrustful of your body, maybe out of control? And if you do, you're not alone. It's very interesting that the way we eat is not only regulated by how our stomach or biological cues tell us to eat. These thoughts are some examples of negative self-talk. They have some cognitive distortions where distorted thoughts and thinking patterns get in the way of us feeling good and actually enjoying and getting pleasure from our food. There's all or nothing thinking, all processed foods are bad. There's jumping to conclusions. I can never control myself, maybe should or should not statements about what you need to eat or what is good for you or what is bad. And these statements create a perception of food as a moral construct. So creating a hierarchy of foods, what is quote unquote good and what is quote unquote bad, which disrupt our trust with our internal hunger cues. And we impose these rules and tell ourselves that we are allowed to eat or we are not allowed to eat certain things. Now let's think about other biological mechanisms that we have that let us know when we need to do things. For example, going to the bathroom. Do you ever tell yourself you feel this pressure or urge to go to the bathroom, pressure in your bladder? I already went 3 times today, so I'm just gonna wait until tomorrow to go. Or maybe, oof, I really need to go, but I'm only gonna allow myself to empty my bladder halfway because otherwise it means that I don't have willpower. It might sound silly, but it's very interesting that when we come to these other biological cues, we trust it, we go to the bathroom, we don't associate it with our self-worth. So why do we manipulate our hunger in these ways and manipulate what we eat and how we eat? So when we rely on labeling food as good or bad, putting foods in healthy or unhealthy categories, we're ultimately distancing ourselves from our ability to trust ourselves and be in tune with our hunger. And this can create a cycle of disordered eating. So think about a food you may have heard that was bad, or maybe something that you can't have, but you really love it. It's so tasty, or it's very important cultural food for you, or it's something you eat when you celebrate something. When you're unable to give yourself permission to eat this forbidden food, maybe you have experienced a feeling of being very deprived or being so focused on not having that food that you eventually break or lose this perceived willpower and end up eating that food. And not only might you eat the food, but you might eat it with feelings of guilt, shame, distress. You might have this thought of, oof, I've already cheated, so I'm just gonna allow myself to eat all of it and might eat beyond fullness because you don't know when you will have that food again because it is seen as restricted in your mind. Or maybe you have purging behaviors. Ate all the food feeling really bad about yourself, and you vow that you're gonna go to the gym for 1 hour every single day for the next week to burn it off. Doesn't feel so great, right? And then these feelings, ultimately, maybe you find yourself vowing that this is never going to happen again. I'm going to never buy this food again. I'm gonna be better. And then what happens? What ends up happening? The cycle continues. So this guilt and shame that we experience can often lead to binging or purging, again, leading to this full cycle of restricting food, having it, maybe having too much, feeling bad about it, restricting, etc. And you see, when we use food to define our self-worth, when we demonize foods and ways of eating, it ignores that food is very multifactorial and how food choices and the way we eat is influenced by so many things. It ignores food access and environment and how that plays a role. And it places judgment on other people's eating choices and styles, and you don't know what is healthy for them. So how can we put an end to this cycle and learn to trust our bodies? So mindfulness is a practice that can help us break the cycle. So mindfulness is a practice of focusing one's awareness to the present moment. It has origins and roots in different meditative and religious practices, and over the years have been shown to have benefits on reducing chronic pain, but also influencing our relationship with food and our eating habits. So when we're being mindful, we're acknowledging thoughts without judgment. It doesn't mean that you're sitting there trying to clear everything away from your mind or when you're eating to not have any distractions. Instead, it's a very active practice of noticing, being aware with the sensations that are happening with your body, thinking about the texture of foods, maybe a memory that this food is associated with, and also thoughts that come up. Maybe thoughts that are similar to what we talked about in the previous slide, and just observing them without judgment, acknowledging it, maybe thanking your brain for the thought, I don't need it right now, it won't serve me well, and then bringing the attention back. So mindful eating doesn't mean distraction-free eating, it means eating with awareness. So when you think about it, when we eat and we're not present when we're eating, or when we're eating mindlessly, our brain doesn't register the full extent of the meal that we're consuming. And therefore, we might overcompensate at the next meal and eat more and not feel great about it. But when we eat mindfully, individuals in research have reported decreased response to external food cues. For example, things where people are telling them what to do, what to eat. They report improved awareness with hunger and satiety, when to eat, when to stop because they're feeling full, and also increase satisfaction and pleasure derived from food. There's also been studies about mindful eating and its impact and benefits on people with diabetes. So this study is from 2012, but it's a prospective randomized control trial where 52 adults with type 2 diabetes diagnosed at least 1 or more year ago with A1C of greater than equal to 7 and a BMI of greater than equal to 27 were randomized into 2 groups over 3 months. So they were followed weekly. There were also biweekly sessions. And the first group was a mindfulness-based eating awareness training for diabetes, or MBEAT-D group. And the second group was a diabetes self-management education and smart choices-based group. So in the smart choices-based group, this went over medical nutrition therapy, benefits of physical activity, glucose monitoring, medication management. And the mindfulness-based awareness training group also went through similar things, but in addition, it had mindfulness training. So they learned about mindful meditation, how to practice eating and observing your body. Each session in the mindfulness group included guided meditations oriented towards experiences and emotions associated with food intake. And participants were encouraged to meditate daily and also meditate before meals. So what they found at the end of the 3 months and also 3 months at follow-up is that there was a statistically significant reduction in both groups in energy intake, weight, and BMI. There was also a statistically significant reduction in A1C in both groups, average of 0.4 to 1 point or percentage decrease. And while there were no statistically significant differences in between groups, which means that we cannot determine if one group or intervention was more effective than the other, I think this study shows us that there are many different ways to manage your diabetes. It's great to have the knowledge, learning different topics, and also that mindful practices can be a great tool to create positive health outcomes. So let's practice. I'm going to lead you through a mindful breathing section. So I want everyone, if it's available to you, to sit upright. Maybe put your feet flat on the ground. You can close your eyes or maybe look down with a soft gaze. Start bringing awareness to your breath. Maybe notice how it enters and exits your body. Observe how the air goes through your nose, whooshes through your throat to your lungs. Maybe feel how your stomach expands as the breath fills your lungs and your belly. Maybe you notice the sound of the air entering and leaving your nose or your mouth. Maybe you notice any smells in your environment. Now take a couple seconds to go through another few rounds of this breathing. Maybe at this time, you're noticing your mind is getting a little chatty. Maybe you're thinking about, what am I having for dinner today? Or what else do I need to do? Acknowledge those thoughts. They're just thoughts. Then gently bring your attention back to your breath. Go through a couple more rounds of in and out breathing. Focus on the sensations, what you feel in your body. And when you're ready, open your eyes. Bring your attention back to the room. Let's reflect. What emotions did you feel when that happened? Were there any sensations you noticed that you weren't aware of? If you noticed you had a lot of thoughts coming into your mind and maybe your mind was a little busy, nothing wrong with that. It just means you have plenty of opportunities to observe them and practice redirecting back to your breath. So now that we've practiced mindful breathing, how can we apply this to eating and tuning into our hunger cues? So maybe the next time you want to reach for food or you have the urge to reach for a snack, can you take a mindful pause to assess your hunger? Take a few breaths like we just did, and think about the sensations in your body. Can you determine what your hunger is from 1 to 10? 1 being the extreme, you're starving, you're famished, you don't feel good. 10 being you're so full, painfully full that you might throw up. The goal is to begin eating when you first get hungry. Maybe when you're at a 3 or a 4, maybe your stomach is growling a little bit, starting to talk to you. Maybe you notice feeling lower in energy. When we eat when we're hungry and just starting to get hungry, we find that it's easier to eat mindfully, it's easier to enjoy our food, and also stop when we're at a 5 or a 6, when we're full. Now think about what happens if you don't eat until you're at a 1 or a 2. Think about the foods that you start craving. Maybe those sweeter, saltier, crunchy foods, things that can give us energy quickly because we're so hungry and need energy right now. And then think about what your eating behavior looks like. What happens next? Maybe you're so ravenous that you're more likely to eat really quickly. And all of a sudden, you're at an 8, you're feeling stuffed or more. Does this sound familiar to you? So this goes to show that when we allow ourselves to get too hungry, it puts us at risk of these behaviors that make us feel not so great about ourselves, maybe eating beyond fullness. And when we acknowledge and honor the hunger when we're hungry, 3 to 4, then we're more likely to be more mindful and present with our food and enjoy it. So when we are at a 3 or a 4, honor your hunger. And in terms of blood sugar management with diabetes, what does that mean? So I want you to think about in that moment, maybe do some more mindful pauses or mindful breathing. What sounds good to you right now? And can you think about adding things instead of subtracting? And can you think about maybe having different nutrients for your meal or your snack? So we know with blood sugar regulation, things with fiber paired with protein and fat give us satiety. It helps food digest slower from our system so that the breakdown of carbohydrates into glucose is slower. So the blood sugar rise is more stable, and it's correlated with our energy levels. We feel more energized when we have had enough to eat and the proper nutrition. So here are just some examples of foods I've put together that might look like this equation. So you might have chapati, you get lots of protein and fiber from the dal, lots of veggies from the sabji. Maybe you're having some rice paired with chicken adobo and getting some more flavor from the veggies and the pinakbet, or some corn tortillas paired with pozole and a side of nopales. Or maybe you're not too hungry for a big meal, but you just want a snack. You can combine fiber-containing whole grain bread with some fat and protein-containing nut butter, or maybe some Greek yogurt with some berries. So just some ideas, thinking of adding nutrition rather than taking away and putting us back in that restrictive mindset. Now, what about those times where we're not at a 3 or 4, but we still want to reach for food? I want you to ask yourself these questions. What am I feeling right now? Can I identify any emotions? Am I feeling any tension in my body? Is there something I need right now? Am I feeling bored, tired, or lonely? and identify your need. What do you need right now? And how can you self-soothe? For example, if you're needing connection, can you call your friend or a family member? If you need comfort, can you pet your dog or cat or rabbit? If you're feeling stressed, can you pause and take some mindful breaths? You're breathing already, so why not bring your attention to it? Or if you're in between meetings or really busy, can you take a 3-minute break and listen to your favorite song? And also, if you go through this practice, you find out that you're not physiologically hungry, but you still want to reach for a snack or some food, know that it's okay, because you're allowed to eat when you're experiencing an emotion. We're all emotional eaters to some extent. It is not good or bad moving away from those terms. And also, this practice gives us more insight into what we need. Is it food? Is it something else? And helps us brainstorm, are there any other self-soothing behaviors that are accessible to me at this moment? And proceeding and treating yourself with compassion and kindness. If you decide to eat something, but you're not hungry, can you eat it mindfully? Are you able to enjoy the sensation of pausing, having that delicious food, and then refocusing to whatever task was at hand? If you are, then you're more likely to get satisfaction from that food and less likely to overeat or get yourself in that binge restrict cycle. So to go deeper into our needs, so everyone is very individual with their needs, and I want to bring up Maslow's hierarchy of needs. So this is psychologist Abraham Maslow, who theorized that the human beings are motivated by a hierarchy of needs, where basic needs, or the needs on the bottom, must be more or less met prior to meeting other needs. Over the years, this theory has been refined. We find that the order of needs may not necessarily look like this, and it could be more flexible based on the individual or external circumstances. So we're going through the needs starting at the bottom, physiological needs. So thinking about things you need for survival, air to breathe, water, food, shelter. While our body can still function and adapt, if we're unable to have the full extent of everything we need here, our body can't function optimally without these things. Or maybe you have needs for safety, feeling secure, financial stability, need for love and belonging, feeling connected to your friends and family, being able to receive and give affection and love, need for esteem, being able to recognize your own self-worth, respecting yourself and getting respect from others. And on the top is self-actualization, which Maslow defines as desire to become the most that one can be. So you can think about things or goals or actions that align with your values, things that make you grow personally, allowing for self-discovery. So again, while these needs are very flexible and everyone is very different, and that you don't necessarily need the bottom ones in order to satisfy the ones above that, when we meet our basic needs, the physiological needs for survival, including food, when we are not as at conflict with food and we don't have all these thoughts bringing us down, might we have the capacity to pursue these other needs that are important to us? And I want you to think about, if we practice being kind and compassionate towards ourselves and our hunger, our eating behaviors, maybe we'll be better able to do that to others as well. Just some food for thought. So going back to the first slide where I put out the different thoughts and statements that demonstrate cognitive distortions or negative self-talk, if it happens again, can you pause and ask yourself and dig deeper into what these thoughts mean to you? If you're realizing that you're connecting your food choices and eating behavior to your self-worth, then that gives us more insight, right? Are you somehow more or less or better than for eating a certain way? And after identifying these thoughts and what's behind them, I would challenge you to think of a statement to tell yourself that makes it more neutral. So food neutrality, by that I mean removing judgment from food and yourself for eating it, giving yourself unconditional permission to eat with no limitations, free of guilt and shame. So one example for the I might as well eat the whole box because it's my cheat day, I'll eat clean for the rest of the week. Maybe you can tell yourself, I'm allowed to eat and nourish my body. Food is not a reward or something to be burned off. For the thought of, I keep all sweets out the house because I can't control myself, you can tell yourself, my food choices do not define my self-worth. I'm allowed to eat and I can eat without judgment. And for those who have this thought internally, or maybe you hear this from others, don't eat that, it's so unhealthy. Can you tell yourself, healthy is subjective. What sounds tasty and what will help make me feel satisfied until my next meal? Other ways of reframing thoughts are when these thoughts come up, you recognize that they're distortions. Maybe you can give these thoughts a name. You can say, oh, this is just X telling me what to do. Thank you for offering your opinion, but it's not serving me well right now. And then do your best to approach it from a non-judgmental perspective and move on. You can also think of the analogy of maybe you have a pet cat, decides to bring a dead animal and drop it on your doorstep. So the dead animal probably doesn't benefit you in any way, but you see that your cat is trying so hard and is so pleased with itself that, thank your cat for offering this animal, doesn't serve me, and acknowledge it and move on. So in short, all types of foods can hold importance in your diet, regardless of its nutritional value. Food is food. It has cultural ties, it's pleasurable, it's social, it's emotional. How lucky are we that we're able to have this capacity to experience and enjoy food when we make peace and trust our body with our hunger? So in summary, think about if anything in this presentation stuck out to you, any practices that you might want to bring into your routine. Maybe it's taking a few mindful breaths. We build habits. It's easiest when we attach it to something that's already in our routine. For example, brushing our teeth, sitting in traffic. Can we take some mindful breaths then? Can you practice it before a meal or when we want to reach for food? Think about where your hunger or fullness lands on that scale. Is there another need that needs to be satisfied or isn't being met right now? Can you brainstorm some ways to self-soothe and manage and meet that need in that moment? And also challenging your thoughts when you notice negative self-talk. What can you tell yourself to move towards a more neutral relationship with food? And with that, that's the end of my presentation. Thank you everybody for listening, and I'm happy to take any questions.
Thank you so much, Catherine. I really learned a lot and really enjoyed the opportunity to do some deep breaths and really think about that as well in it. So thank you. You do have a question. Somebody was just asking, I was told that keto foods have a lot of fat. Is this true?
Yeah, so keto foods, first I would ask, how is keto being defined? So keto is different among different scientific communities and also different fad diets. So if you're referring to keto foods, I think if you're referring to packaged foods, so usually this correlates with a higher fat, lower carb food. And yes, there might be more fat in it just due to the fact that it's labeled as keto. And then, so to answer your question, typically, yes, compared to, usually it's a product that's used to substitute or replace a certain food. If it's marketed towards diabetes and for blood sugar management, you can think about if it has more fat, which is very satiating, and less carbohydrates, it's more likely to not cause a big spike. But it doesn't mean that you have to follow a keto diet or eat a large amount of fats to manage your blood sugars.
Great. This is another question. First they start, thank you so much. And then, do you find it hard to meditate before a meal if you're really hungry or very excited to eat it?
Thanks for your question. And absolutely, it's a lot harder to do this when I'm hungry, or maybe I had a long day or I didn't plan well enough so that their hours went by without food and I just want food right now. Likely I'm just going to allow myself to have it. And then also thinking back to the hunger scale, maybe next time thinking about, when I'm starting to get hunger, what does that feel like, so that I can recognize it. Maybe that means having a plan, having some snacks on hand that can help satisfy your hunger in the moment, and then set you up for success so that you don't have to do a very long meditation, but can you even do one mindful breath, or maybe take a few mindful bites?
Great. Are there any other questions? While you're thinking of your questions, I also wanted to just give a quick plug that our next session is on, it's going to be more of a cooking schedule. Jessica Shipley is going to talk about kind of some snacks for the summer that are carb controls. Oh, we have another question. So what is the average amount of carbs someone should have if they're trying to lose weight in type 1 diabetic and on a pump?
Great question. So individual carbohydrate needs are very different from person to person. If you are on insulin and a pump, you might have been given an insulin to carbohydrate ratio. So as long as you're covering for the carbohydrates in whatever you're eating with the insulin, it should help stabilize the blood sugar. When we do have mixed nutrient meals, thinking of pairing the carbohydrates with protein, fat, and fiber, that helps a lot as well. If you're looking for a specific number, typically anywhere from 30 to 60 grams per sitting of carbohydrates is an amount to start with. And then I would just look at your pump data to see what your blood sugar does and then go from there.
Great. This is another kind of question comment. My spouse and I have found this very helpful. I often make judgment comments about her diet and have been unsuccessful. Any other thoughts?
Thank you for sharing that. And I think we all have maybe made judgmental comments to ourselves or someone else, and it's never ill-intentioned. I think it comes from a good place, and maybe asking yourself, why am I making this comment? Or why do I feel the need to say this? And then getting to the root cause and then going from there. And then also, yeah, like you said that it might not be helpful or it's unsuccessful. And we do find in research when we try to punish ourselves or when we restrict ourselves or not allow us to do things, that might be all we think about, and it could sabotage our goals. So just being mindful and also being gentle with yourself. It's okay that you had those thoughts. There's a lot of contributing factors that you can explore that might have led you to make that judgment or that thought. And then how can you move forward from that?
Yeah, another question. How would you recommend using mindfulness when dealing with low blood sugar events?
Good question. Yeah, low blood sugar events are very scary and could be lots of emotions happening when that happens and you're not physically feeling very well. If you have the capacity to do so, taking a breath, and again, it doesn't have to take a lot of time. If it's hard to think about what you need to do to correct your blood sugar, just giving yourself that space, allowing yourself to feel all those things, even if they don't feel very good, and then think about what you need to do. Getting that quick acting carbohydrate to drink or to eat to bring your blood sugar back up.
Great. We do have another question on kind of another fad diet. Somebody wants to know your thoughts on intermittent fasting.
Yeah, so intermittent fasting. Intermittent fasting, also everyone has different interpretations. I think one of the most popular ones are the 16-hour fast and the 8-hour eating window. In research, there have been some suggestions that intermittent fasting could lead to weight loss if that's someone's goal. There's also some research about perhaps improving insulin sensitivity in people with diabetes. However, I think it's very individual. So if you want to try it, you could definitely do it and maybe just observe how you feel during it. For example, if you notice that you're telling yourself and being very strict that you have to eat from a strict window and you find yourself being really hungry after that, then maybe think about, is this something that's aligning with my goals? Certainly don't have to follow a particular diet or trend in order to eat mindfully and manage your blood sugars.
And great. I think that those are all of the questions that we have. Other people said just thank you for the great talk, a lot of food for thought. So excellent. Thank you so much, Catherine. Really kind of great to learn about mindful eating and to have so many examples and ways to practice. So hope that everybody really enjoyed, and hope to see you next month as well. The recording will be up on the Health Library, Stanford Health Library website as soon as we can get it uploaded. So thank you all. Have a great night.
Thank you.